In today's episode, we are going over an evidence based guide to lateral ankle sprains. We're going to be talking about return to sport, return to work, and future injury prevention. Let's do it. So, what's the problem with lateral ankle sprains? So, lateral ankle sprains are very, very common. Depending on the study that you look at, it is the number one injury in sports. Okay. Again, that's going to vary based on the population. It's very scary when it occurs. It's one of the major reasons why folks go to the emergency room. Symptoms typically resolve pretty quickly after you have a lateral ankle sprain, and largely that's a good thing. But the problem is that up to 50% of folks after they have a first lateral ankle sprain will have recurrences. So they tend to occur again in the future, or they're left with some sort of long-standing instability, pain, swelling. We'll talk about this a little bit later, but something known as chronic ankle instability, which is another big problem. Largely, it's not taken very seriously as an injury, despite a lot of folks going to the emergency room. A big chunk of folks that do end up with a lateral ankle sprain, they don't end up seeking medical attention. Before we get started, I just want to give you a big thank you for your support. You truly allow me to do what I love for a living. My name is Dan Pope. I'm a physical therapist. I'm a coach, personal trainer, and meathead. This is the Fitness Pain Free Show, where we help coaches and physical therapists like you get your patients out of pain and back to training. If you're watching this on YouTube, hit that like button, comment, and subscribe to the channel. And if you're listening to the podcast version of this, please give me a positive rating and review. Helps me out tremendously. I've also created an evidence-based guide to ankle sprain injuries cheat sheet. It's a handout that goes along with today's lesson. We go over all the basic points I just went over: prevalence, history, prognosis, predisposing factors, mechanisms of injury, anatomy, diagnosis, differential diagnosis, treatments, return to sport and work, and injury prevention. I'll leave a link in the show notes, 100% free. You can go ahead and download that. Again, it's a companion for what we're going to go over today. It's also a really nice reference sheet that you can go back on a little bit later in the future. If you kind of forget what I went over, you want a quick refresher, it's all going to be there. So the majority of the information we're going over today is from one article. It's from the British Journal of Sports Medicine. I'll leave a link in the show notes so you guys can definitely check that out if you're interested. It's called Diagnosis, Treatment, and Prevention of Ankle Sprains, Update of an Evidence-Based Clinical Guideline. So this was a great paper. It's a little bit older. It's 2018, right? But when I was doing my deep dive, my literature review, and trying to figure out the best papers to include in this presentation today, this was by far the best. So if there's some more information after 2018, I actually included that, and I'll put all of my references in the show notes, but largely the majority of the information today is actually coming from this article. This is part 4 of a 4-part series. If you haven't checked out the first 3 parts of this series, I'll leave a link in the show notes. Check those out before you watch this. All right, let's get rolling. Return to work and return to sport after lateral ankle sprains. The average time to return to sport after lateral ankle sprains is 16 to 24 days. And up to 40% of these injuries become chronic ankle instability or some sort of recurrent injury. In NCAA athletes, 44.4% return to play in less than 24 hours, and 3.6% required more than 21 days after returning to play, including those who did not return to play at all. So the large majority of folks, again, they get better within about 2 weeks or so. Okay, so this is not an injury that tends to stick around, at least pain-wise, for a long period of time. There's pretty rapid resolution of symptoms, and folks get back to sport and activity pretty dang quickly. Again, the problem ends up being that lateral ankle sprains are one of the most common injuries sustained during sport, but they're often perceived to be minor injuries that heal expediently with minimal need for therapeutic intervention. More than half of individuals who sustain a lateral ankle sprain injury do not seek formal medical treatment. There is currently no criteria-based guidelines to inform return to sport decisions following acute lateral ankle sprain injury. So a lot of these folks tend to get better pretty quickly, get back to sport very quickly. However, they have longer-term issues. So if we have some sort of return to sport criteria, maybe that'll help us to reduce the incidence of recurrences and/or chronic ankle instability in the future. And a premature return to sport, so folks getting back too quickly, may be one factor that contributes to the high prevalence of recurrent ankle problems. We did reference literature earlier that if folks are returning to a high work volume, right? So largely if you sprain your ankle and now you're doing a whole lot of sport afterwards, that may increase your chance of having recurrences and/or chronic ankle instability. So it makes sense. We should probably make sure we do a really good job rehabbing these folks prior to returning back to sport. And again, despite being the most commonly incurred sports injury with a high recurrence rate, there are no guidelines to reform return to sport decisions following acute lateral ankle sprain injuries. More than half of individuals who sustain a lateral ankle sprain injury do not seek formal medical treatment. Many return to sport before injury associated impairments are resolved. In fact, 71 to 75% of U.S. high school athletes were sanctioned to return to sport within 3 days of incurring a lateral ankle sprain, with 95% sanctioned to return to sport within 10 days of injury. So the large majority of athletes are getting back in less than 2 weeks after lateral ankle sprain injury. So, when we're looking to return back to sport or work, we know that a supervised exercise program like physical therapy, focusing on a combination of proprioception and balance, strength, coordination, and functional drills or return to sport drills, is going to lead to a faster return to sport. So, if folks do some physical therapy, they get back to sport faster. Okay. And this stat is also amazing to me. But when exposing athletes with recurrent sprains to proprioceptive training to improve joint position sense, the risk of recurrence of lateral ankle sprains is reduced to the same level as healthy controls. Okay. Now, what that means is if I have an athlete that gets a lateral ankle sprain and I do a good job with the rehab, now the risk of injury is right back to where it was prior to the injury. Okay. But if I don't do that solid rehab program, then they have a 50% chance of having recurrences, chronic ankle instability, and potentially osteoarthritis over the course of time. It seems like a no-brainer to me that every single person that gets a lateral ankle sprain should probably be placed on some sort of rehab program to help them out. So a major problem that we have is that we know that some sort of exercise-based program after having a sprain injury is going to be important. Okay. We just don't know how much we need and when athletes are going to be ready to return back to sport. Okay. So BJSM 2021, they attempted to put together a return to sport criteria after lateral ankle sprain. This is from Smith et al., BJSM 2021. I'll put a link in the show notes if you guys want to actually read this article. So they developed a consensus statement using Delphi survey process. What is the Delphi survey process? It's a technique that's well established to answer a research question through the identification of a consensus view across subject experts. So largely 198 people completed a series of surveys, right? I think initially they sent out 250. They ended up getting 198 responses, and they sent it out to people they felt were most relevant or the best experts to answer these questions. So there's 3-round surveys were included, and they basically included the items with greater than 70% agreement. So if there was a large discrepancy between experts on a certain topic, let's say range of motion after ankle sprain, then they weren't including that in the consensus statement. The folks that were involved were health professionals, so physical therapists, athletic trainers or therapists, and sports medicine physicians. They also included athletes competing in nationally selected representative teams. They chose those working in field or court sports where acute lateral ankle sprain injuries are among the most prevalent. They also used those involved in making return to sport decisions for athletes with an acute lateral ankle sprain injury. So they did a pretty good job of selecting folks that were considered experts in the field of lateral ankle sprains. And they utilized a series of 3 surveys sent out to these folks to try to figure out some sort of consensus in the way that we start treating these folks and then returning them back to sport after lateral ankle sprain. So they created this PASS criteria or framework. So PASS, PAASS. The P stands for pain severity. This is both during sports participation and over the last 24 hours. Keep in mind, pain tends to resolve very quickly in lateral ankle sprains. So they didn't want to include pain over the prior week. They chose to include pain in the past 24 hours since these things tend to get better very quickly. They're looking at ankle impairments. So basically ankle range of motion, ankle muscle strength, endurance, and power. They believe this was important for return to sport. They're looking at athlete perception. So perceived ankle confidence or reassurance. They're looking at perceived ankle stability. Do the athletes feel like their ankle has regained stability over the course of time? And also psychological readiness. Do the athletes feel like they're ready to return to sport? The S was sensor and motor control. So is their proprioception returned? Do they now have better dynamic postural control or balance? And the last S stands for sport/functional performance. So hopping and jumping test, agility test, sport-specific activities, and ability to complete a full training session. So PAASS, pass. So essentially, if they pass these tests, they're ready to return to sport. So this consensus statement is just a framework. They did not nominate specific tests or outcome measures for these variables. It does not specify how clinicians should assess these items. So if we're looking at athlete perception and psychological readiness, maybe use an outcome measure for psychological readiness to return to sport. However, they didn't say to use that specific outcome, right? There's no data on cutoff points for measures that indicate if an athlete should or should not return to sport. So largely, they weren't looking at research showing that if your ankle range of motion is not full, right, then you shouldn't return back to sport because you're more likely to get hurt compared to someone who regains their full range of motion. That evidence doesn't exist. We're just trying to come up with some sort of framework to help our athletes out. And this is our best guess so far, how to evaluate these athletes to figure out if they're ready to return to sport. So I've taken the past framework and I've come up with some ideas that you can use for your patients, right? So again, just keep in mind, I kind of came up with these based on my own assumptions of this framework or criteria. This framework or criteria is not perfect, but I think if you go through this a bit, it'll help you out figuring out which athletes are ready to return back to sport. We're not just throwing athletes back kind of willy-nilly, right? So, guys, if you like what you're learning about so far, then I want you to go and check out the Fitness Pain Free Mini Course. So, I made a mini course. It's absolutely free. That's the next logical step if you want to learn more from me. So, in the course, we go over 5 lessons. That first lesson is how traditional schooling has failed us, right? So, schooling is phenomenal from a physical therapy perspective, but doesn't really teach you how to work with high level athletes in the fitness world, right? Doesn't always teach you how to do the lifts appropriately. Doesn't teach you about progressions and regressions of common lifts within the gym. Doesn't teach you how to program normally, how to write rehab programs, or how to write injury prevention programs for these folks. Next thing we go over, 7 reasons why people get hurt in the gym, 4 simple steps to getting your clients out of pain, how to build the career of your dreams and earn the respect of your community. It's all well and good if you know exactly how to work with folks within the gym. But if you can't get these folks through the door on a regular basis, then you're simply not going to be living the dream that you want to because you can't get the patients through the door that you want to work with. Okay, so I'll show you how to do that. And lastly, we'll talk a little bit about the Fitness Pain Free certification, right? So I'll leave a link in the show notes. I definitely recommend checking this out. Once you sign up for the Fitness Pain Free Mini Course, you will be automatically placed in the waitlist for the Fitness Pain Free certification. Now, the Fitness Pain Free certification is the course, the certification that I wish I had as a new grad that fills in all the gaps in knowledge that you don't get in physical therapy school. So A, you'll gain complete confidence working with injuries in the strength and fitness world. You'll learn optimal technique for both health and performance from myself and some of the best coaches in the world. You'll master programming for rehabilitation and injury prevention. Have fun while earning a whole bunch of physical therapy and physical therapy assistant credits. You have 31.5 of those. You'll also gain NSCA credits as well as CrossFit credits if you need those. This is the equivalent of a university education in working with injuries in the weight room. I really believe that. I've been adding to this thing over the past 5 or 6 years. It's massive, a ton of phenomenal information. And lastly, the biggest goal is just to fill your day with the patients you love working with and building the respect and admiration of the communities you love working with. So I'll leave a link in the show notes. Sign up for the Fitness Pain Free Mini Course. The certification is open 4 times per year for 1 week to enroll into. If you're on the wait list by signing up for the Fitness Pain Free Mini Course, I'll alert you when that next enrollment period is open and you can get started. Let's get back to the show now. So for pain severity, you can pretty easily use a VAS scale, so 0 to 10 scale of people's pain. I would recommend people have minimal to no pain before you return back to sport. In terms of ankle impairments, we can look at strength of the plantar flexors, dorsiflexors, inverters, everters. And I would say you probably want 90% plus on isometric testing before returning athletes back. From an endurance perspective, we can look at calf raises or toe raises to failure. How is the endurance looking like of the calf musculature, the tibialis anterior musculature? In terms of range of motion, we probably want to be within normal limits or around 90% symmetry between sides. Do keep in mind that a lot of these folks end up with longer term issues with range of motion. Sometimes you'll see folks have too much inversion, but they don't have enough dorsiflexion. I think this is largely just related to the way these things heal over the course of time. So having 100% range of motion between sides might not be reasonable for all athletes. From a power perspective, we could be looking at, let's say, single-legged pogo jumps, your ability to maintain a specific metronome for a period of time. We could also test hopping on a force plate left to right to see what is that rate of force development. Are we gaining symmetry between sides? From an athlete perception perspective, we can use outcome measures like a psychological readiness questionnaire. So, largely, do your athletes feel like they're ready to return back to sport after having a lateral ankle sprain injury? We can measure sensor and motor control via either a STAR excursion balance test or Y balance test. We can also look at balance with eyes closed. There's a variety of tests that might be worthwhile checking out with your patients. From a sport or functional performance perspective, we can look at hop testing, both vertically or horizontally. We can also look at some jumping in the frontal or transverse plane. We know that, let's say, a lateral ankle sprain has trouble handling forces in the frontal plane. So maybe that's a little bit more relevant for those athletes. We can look at agility drills that are sport specific, maybe something like a T drill, pro agility drill, something along those lines to see if people are getting ready to return back to sport. And I think the other piece that's probably going to be important is the ability to complete a full training session. So not just to get through it, but to get through it with minimal to no pain and then minimal to no swelling, reduced range of motion, or excessive soreness following practice. So what are our timelines to return to sport after someone has a lateral ankle sprain injury? So we already know the large majority of folks are getting back within the first couple of days. Okay. Now, it's just that those folks are getting back might not actually be ready. Okay. And that's the problem. And the other part is that there's a wild difference between return to sport time between individuals. And that's going to depend on a lot of different factors. So, largely, what was the grade of the injury? What is the sport or activity the athlete wants to get back to? Getting back to, let's say, rowing or weightlifting is probably going to come a lot faster than returning back to basketball. It's probably going to depend on the individual. How old is that individual? So if you smoke or you're advanced in age, maybe it takes a little bit longer for you to heal and recover compared to a teenager. And as I said previously, I think the larger question is, are we actually ready to return to sport? If your pain levels are down and you feel as though you can return back to sport, does that mean you're actually ready to return to sport? So we probably want to try to use some sort of past framework, some sort of return to sport criteria that we can utilize to figure out if folks are truly ready to get back to sport. The next important thing that I think as physical therapists, we should start to think about a little bit is going to be tissue healing times. So after you have an injury, there are three distinct phases of healing. We have an inflammatory stage, we have the proliferative phase, and we have the remodeling phase. Largely, inflammatory stage starts right after the injury. Then you move into proliferative phase, and then you go into remodeling phase. So the remodeling phase is going to begin around week 2 after someone has an injury. Now, these stages are very different based on the ligament. So if you have a ligament inside a joint, that's going to take a little bit longer. So these numbers are probably going to vary quite a bit based on the ligament. But if you have the remodeling phase, which is going to start, let's say, around 2 weeks and extend on for years after someone has an injury, starting at week 2, however, majority of your athletes are getting back within 10 days. Are you actually healed in that ligament before you're returning back to sport? I think undoubtedly, no. We're probably not fully recovered in that ligament before we're sending our athletes back. I just think when people sprain their ankles, it's interesting because if you have an injury to, let's say, your ACL or your MCL or your LCL, or maybe in your elbow at the UCL, right? Or maybe you have a Bankart tear, you have a shoulder dislocation, something along those lines. It's very, very common for physicians to try to shut down these athletes for somewhere between 6 and 12 weeks, right? That's standard advice. If you sprain your UCL, hey, let's give it 6 weeks, stop throwing. And after 6 weeks, we can slowly start to ramp up your throwing over the course of time, right? If you tear your ATFL, 50% of folks are getting back within 24 hours. That's crazy. And I think the whole idea of feels good versus ready to play are entirely different things. We know if you return your athlete back quickly without doing some sort of rehab program, you're predisposing themselves to a poor outcome, potentially recurrence, instability, maybe some longer term osteoarthritis. So I think at the end of the day, as physical therapists, it's probably important for us to start thinking about these injuries as maybe something that's a little bit more important and maybe not sending our athletes back within the first couple of days after lateral ankle sprain, taking these a little bit more seriously so our folks have a better long-term outcome. And it's not just, okay, you sprain your ankle, no big deal, rub some dirt on it and get back out there, right? That's probably not a great way to do it. So what are my opinions on timelines for returning to sport? So, I think we should probably be waiting a little bit longer to return to sport in the large majority of athletes. Okay. You have to keep in mind. So, the ligaments in your ankles, largely, they're not intra-articular. So, maybe they have faster healing times than, let's say, an MCL injury or another injury to another ligament that heals a bit slower. I believe that 4 to 6 weeks should be a little bit more standard. So if you look at the duration of the physical therapy programs, again, I'll leave a link in the show notes for the references. These folks were doing somewhere between 4 or 8 weeks of physical therapy, right? So we probably need to be doing physical therapy for a longer period of time before athletes get back. The other piece is that the amount of time it takes folks to get back to sport after a lateral ankle sprain is going to be very, very variable, obviously, depending on the grade and other factors. So, we probably need some sort of return to sport criteria to figure out when folks get back. Okay. If someone has regained all their strength, all the range of motion, the proprioception, they feel super ready to return back to sport, maybe we can get them back at week 2. Right. But the same person that had a lateral ankle sprain at week 2 that has no strength, poor range of motion, still hurts, can't get through practice, we probably have to delay them a little bit longer. All right. We need some sort of system that we can figure out which athletes get back sooner, which athletes are going to take a little bit longer. And currently, we don't do that. And lastly, we should probably base our return to sport times on the activity that the person is trying to get back to or the sport the person is trying to get back to. So if I'm trying to get back to, let's say, Olympic weightlifting, right? I actually worked with a lot of CrossFitters that sprain their ankles because they fall down on a rope climb and land on the rope. Or they're doing pull-ups and they kind of come down on a plate and they roll their ankle. Okay. Those individuals, as long as they're being safe, can probably get back to CrossFit a lot faster because they're usually not doing any cutting in their program, right? Or much jumping. If you compare that to a basketball player, they have to run, jump, cut, change direction, all these things just to play their sport. So they're probably going to take a little bit longer to return back. The position is also going to be important. If you look at the demands of, let's say, a football quarterback versus a wide receiver, a wide receiver has a larger demand on that ankle. They may take a little bit longer to get back compared to your quarterback. How about future injury prevention? Is there a way that we can help to reduce lateral ankle sprain recurrences after we've already had a primary lateral ankle sprain? And the answer is yes. But what forms of treatment are actually effective for reducing injuries? In terms of footwear and shoes, there is no evident conclusions that exist on the role of footwear in the prevention of ankle sprain injuries. A lot of this research was looking at low tops versus high tops. Doesn't seem that footwear is going to influence your rate of re-injury over the course of time. How about bracing or taping? Well, it looks like bracing and taping actually reduces the risk of both recurrences as well as first-time ankle sprains. And this is especially true in folks in sports. So it might be worthwhile for basketball players to wear something like an ASO after they've had a primary injury. And it might actually be worthwhile to wear that before folks have gotten hurt. Okay. So it seems like wearing those things helps reduce the rate of injury in folks that even haven't had an ankle sprain injury quite yet. So the recommendation coming from the British Journal of Sports Medicine is that both tape and brace have a role in the prevention of recurrent lateral ankle sprains, despite limited evidence on mechanisms that lead to these beneficial effects. The choice of usage should depend on personal preferences, although keep in mind it does seem a bit like the functional braces perform a little bit better than tape. Is exercise helpful to reduce future injuries? Yes. Coordination and balance training have been shown to prevent recurrent ankle sprains. The effect size is even larger in athletes. So if you have an ankle sprain and you're trying to return back to sport, if you perform a rehab program, that's going to reduce the likelihood of having a future injury. So when exposing athletes with recurrent sprains to proprioceptive training, the risk of recurrence is reduced to the same level as healthy controls. I know that's the third time that I've quoted this, but I think that statement is so powerful. If you have an athlete that sprains their ankle, if you do a good job from a rehab perspective, you reset their risk back to that before they actually had the injury. And that's very, very powerful. The large majority of folks, or around 50%, are going to have chronic issues moving forward. We can reduce a lot of that, and I think we should. So our BJSM recommendation is that it is advised to start exercise therapy, especially in athletes, as soon as possible after the initial sprain to prevent recurrent lateral ankle sprain injuries. Exercise therapy should be included into regular training activities as much as possible as home-based exercise. So do your exercise after lateral ankle sprains. If you guys are enjoying this evidence based guide, I have another one for you. It is the evidence based guide to patellofemoral pain syndrome. So I'm going to leave a link in the show notes. I'm also going to leave a link up in the corner. So go ahead and click on that link if you want to continue with the learning. If you guys are interested in the references, and I do recommend you check those out, I will leave them as a link in the show notes and you can get to reading them. Lastly, I just want to say thank you so much for your support. You truly allow me to do what I love for a living. If you're on YouTube, smash that thumbs up button, leave a comment. I love to hear your thoughts on this presentation and consider subscribing. It helps me out a ton. If you are listening to the podcast version of this, please consider leaving a positive rating and review. Helps me out tremendously. And lastly, if you want to go that last extra step in supporting me, please consider subscribing to Fitness Pain Free Insiders. All you have to do is head to fitnesspainfree.com, click on the programs link, click on Fitness Pain Free Insiders online library, just $1 for a week-long trial, and you get more great learning from me. I'll leave a link in the show notes as well, so you can check that out pretty easily. Thank you guys for watching. I'll see you on the next one.